Let's look at how information in the mode of action potentials, nerve impulses, get into or out of the CNS. They do this by being housed in a spinal nerve. So, a spinal nerve or a cranial nerve is a bundle of hundreds or thousands of axons, uh, each of which are located along a defined path and serves a specific region of the body. So these nerves, whether they're spinal or cranial, are part of your peripheral nervous system. So they're outside the CNS. We're going to get to the cranial nerves when we cover the brain in the next chapter. The cranial nerves come in 12 pairs. They all attach to the brain one way or another. And they vary quite a bit from one another, in that some of these nerves are strictly sensory nerves. An example are your olfactory nerves. Your olfactory nerves are your nerves for your sense of smell. All they do is transmit smell to the brain. They don't have any motor neurons in them. There are some that are strictly motor, where all they do is control effector organs, and then some have both sensory and motor neurons, so they are known as mixed. So there's a lot of variation in the 12 cranial nerves. The spinal nerves come in 31 pairs, and they're all mixed. They're all very similar in that they contain both a combination of sensory neurons and motor neurons. There's 8 cervical spinal nerves, pairs I should say. There's 12 pairs of thoracic spinal nerves. There's 5 pairs of lumbars. There's 5 pairs of sacral spinal nerves, and then there's 1 pair of coccygeal spinal nerves. Nerves are pretty hardy organs in that there's a lot of connective tissue in them. They're very tough. They're not very soft and weak. They're very tough. And that's because of these layers of connective tissue. The outer layer of a nerve is called the epineurium. And then within that nerve, there are fascicles, or bundles of neurons, surrounded by a perineurium. And then each single axon is actually surrounded by a layer of connective tissue called the endoneurium. So you'll notice here is a single axon. It looks to be myelinated. It's got myelin sheaths, so this myelin would actually be surrounded by a Schwann cell. And then surrounding all those, the axon and the Schwann cells would be the endoneurium. So there's a lot of packaging of neurons inside of a nerve. And what this does is it serves as a very protective material for the neurons. So what we're going to do is look at these spinal nerves. We're going to look at what happens to them, because they don't just attach to the spinal cord and then extend out to an area of the body. What they do is they form these nerve plexes. A plexus is a nerve network. So it's where many nerves might interconnect with one another. And then extending out from the plexus is where you would have specific nerves with specific names. So for example, the cervical plexus is obviously in your neck, hence the word cervical. It is formed by the first 5 cervical nerves, cervical spinal nerves, so C1 through C5, come out from the spinal cord, and this would be their roots. Then they interconnect and form this plexus. This is this nerve network called the cervical plexus. And then from that plexus, the nerves have specific names. We're going to learn 4 plexes of the body: cervical, brachial, lumbar, and sacral. And for each plexus, we're going to try to understand the area of the body that it supplies nerves to, and then some of the more important nerves. So for example, cervical plexus has many nerves that extend from it. The supraclavicular nerves, and so on. We're just going to learn what I would consider the most important nerve, and that is the phrenic or phrenic nerve. The reason that nerve is so important is it innervates and controls your diaphragm muscle. And as you can imagine, controlling your diaphragm and being able to stimulate it to contract is vital. You cannot live without a contracting diaphragm. So these phrenic nerves are extremely important, and it's somewhat counterintuitive in that it comes from your neck. These phrenic nerves don't come out, down by the diaphragm. They come out of the neck area and then extend all the way down to the diaphragm. And the neurons are actually coming from C3, C4, and C5 to form that phrenic nerve. You can see that how some nerves might come out of C3 and be able to get down and help form that phrenic nerve. Some nerves from C4 and C5. So there's a saying, C3, C4, and C5 keep the diaphragm alive. So that's an important nerve. This area of the spinal cord, C3, C4, C5 spinal cord, is extremely important. Individuals that get severe neck injuries can succumb to respiratory arrest because the inability to stimulate the diaphragm. So this is the cervical plexus. The brachial plexus has more nerves to keep straight because these nerves are extremely important in medicine, in that a lot of individuals have problems with these nerves, whether it's from an injury, an automobile accident, or maybe carpal tunnel syndrome from using their hands improperly, maybe on a computer all day. So these nerves tend to be the more important nerves of the body because a lot of individuals use our arms so much that they get neuropathies, they get damaged, they get problems with these nerves. But the brachial plexus is right here. It's situated just behind your clavicle, so your collarbone actually will help protect these nerves a bit, although a fractured collarbone might actually harm the brachial plexus. From the brachial plexus, we're going to learn 5 nerves. The axillary nerve, musculocutaneous nerve, radial nerve, median nerve, and ulnar nerve. Many of them should make sense as to where they're going to be located because they run very close to the radius or the ulna or in between the two. Let's look at the table and learn what these nerves do. The axillary nerve, and again, these are all mixed, so there's a motor component and a sensory component. I've bolded the motor component and left the sensory component unbolded. So for example, the axillary nerve controls your deltoid muscle. Notice where it is. It's right where that deltoid muscle is. So the inability to contract your deltoid and the inability to abduct the arm might be due to damage to the axillary nerve. It also sends sensory information from the shoulder joint and skin of the shoulder. So when you see axillary nerve, you basically think armpit and shoulder. The musculocutaneous nerve innervates your elbow flexors, which are your biceps brachii and brachialis, and it innervates the skin of the lateral forearm. If you follow that musculocutaneous, it goes to that lateral forearm. So the skin along here is innervated by the musculocutaneous nerve. The radial nerve innervates your posterior muscles of the arm and forearm. An example would be your triceps brachii. It's a muscle of the posterior arm. And then it innervates the skin of the posterior lateral surface of most of the upper limb. So most of the back of your arm is radial nerve. You'll notice that the radial nerve kind of disappears on us in this picture because it's going in the back. The median nerve innervates flexors of the forearm. It goes into some of your finger muscles. It goes more lateral hand. So notice this median nerve, and it's called median because it's in the middle of the radial and ulnar nerve. It goes right down the center of your wrist. There's a tunnel for it called the carpal tunnel. and it innervates most of these, this lateral side of the hand, thumb, index finger, and middle finger. This is the one that causes carpal tunnel syndrome, when someone has neuropathy of the median nerve due to pressure right here at the wrist. A lot of inflammation can occur in that wrist, and it puts strain and stress on that median nerve. Fairly easy to treat. There's a surgical procedure that relieves the pressure in that wrist. And then finally, the ulnar nerve innervates more of the pinky side of the hand. It runs right by that medial epicondyle, aka funny bone. So if you hit that funny bone there, you might feel exactly where that ulnar nerve is. You'll feel that pain radiating down into your pinky. But it innervates most of the intrinsic hand muscles. So most of your little tiny muscles of your hands and fingers is ulnar nerve controlled. So those are the 5 nerves of the brachial plexus. The brachial plexus also is connected to a lot of these signs of nerve problem. If you damage C5 through 6, you might get this waiter's tip sign, where it's the inability to extend that wrist. We've got wrist drop, which is a radial nerve injury, often associated with fractured humerus, inability to extend that wrist there. The median nerve palsy is similar to carpal tunnel syndrome, in that there's either pain but also motor, improper motor control, especially of that thumb side. Ulnar nerve palsy, which would be along that pinky side, inability to extend that pinky and middle finger. And then we didn't talk about this nerve, but the long thoracic nerve controls the serratus anterior, and that causes a sign called winging of the scapula. This is just to give you an idea how important it is to know these nerves. And when the nerve is damaged, quite often we get these very predictable signs. Next plexus is the lumbar plexus. The 2 most important nerves from the lumbar plexus is the femoral nerve and the obturator nerve. The femoral nerve innervates your quadriceps muscles, so that anterior thigh. The obturator goes more medial, so it goes to the adductors. Recall the adductor muscles are in your medial thigh. So those are 2 really important nerves that come off this lower back lumbar plexus. Then finally, the last plexus is called the sacral plexus. A lot of these nerves come out of the sacral foramina, the little holes in the sacrum. And the most important nerve there is this big one called the sciatic nerve. The sciatic nerve is actually the largest nerve in the body, but it's a combination of the tibial nerve and the common fibular nerve. So notice here they're together, but we're going to see what happens to the sciatic is the common fibular and the tibial nerve separate from one another. But this nerve controls your hamstrings, so that's posterior thigh. This nerve goes down the back of the leg. So everything kind of posterior leg, you want to think sciatic. Individuals that have sciatica know exactly where their sciatic nerve is, because you get a lot of this pain in your buttocks, and then it extends down the back of the leg. This can be common during pregnancies. So a enlarging uterus due to the baby can press on these nerves. People with lower back problems, lumbar spinal problems, can have sciatica. Occasionally hip injuries, hip damage can cause sciatica, because notice the sciatic nerve is right by that hip. And then gluteal injections, improperly done, can hit the sciatic nerve. Here's just a couple last images showing where these nerves can be identified. This is the same leg, it's the right leg, but this is an anterior view showing the nerves of the lumbar plexus, which is up here. This is a posterior view of that same leg, but it's showing the nerves of the sacral plexus. So notice the three, we mentioned two previously, but there's actually a third major nerve called the lateral cutaneous. Goes laterally. Femoral nerve is going to be right down the center of the anterior thigh, whereas obturator, you want to follow it to the medial aspect where those adductors are located. And then this is a posterior view. So here's the sciatic nerve, that big nerve coming out of the sacral plexus, and then it's going to separate into the tibial and the common fibular just above that popliteal region. So those are the nerves of the lumbar and sacral plexus. The last video is going to talk a little bit about dermatomes, and then finally some of the common reflexes of the body.